Hey guys, today we're going to talk about communication. This is a very important part of this class. It's one of the major components that I want you to get from this class. So we're going to go through this PictoChart, which is available to you. Hopefully you can follow along, and I've also posted some notes, a template for you to follow if you want to take notes on. So hopefully that will be helpful to you. Completely optional, of course. All right, so first we want to talk about what is communication. Communication is the process of sending and receiving messages. And we know this, right? We have two different types. We have verbal communication and nonverbal communication. So verbal communication is the use of language. Now that could be with our mouths, right? Verbal. But it could be through text messages, could be through emails, could also be sign language. Sign language is language. So that is verbal communication. Nonverbal communication makes up the majority of what we actually communicate with somebody. You know, our tone of voice. Screaming is going to give a different message than whispering, right? So that's part of communication. The way we use our body, eye contact, facial gestures, how we're standing, what we're doing with our hands. Those are all part of nonverbal communication, and that is a big component of communication. So those are some things that I want you to think about. You know, it's not just what we're saying, it's how we're saying it. And if you've ever been in an argument with someone like your spouse, then you know you've had that argument. It's not what you said, it's how you said it. So this process of communication is sending and receiving messages. All right, so we have a sender, and then we have a receiver. And that person is interpreting what the sender is sending. And we want to be able to do this effectively. This is especially important in our field because the things that we say could mean life or death to somebody, right? If I as a nurse am giving instructions, discharge instructions to a patient, and that patient is not receiving it, not understanding it, that could be detrimental to their health. So I want you guys to learn about ways to communicate that are effective. Effective and therapeutic. Those are two big terms there. Effective communication and therapeutic communication. All right, really, really important. So let's go to the next slide. We have a whole lot of barriers to communication. So the first one here, confusion. This is a huge one. You know, a lot of the patients and residents that we're going to be taking care of are confused. It could be for a lot of different reasons. It could be medication is causing them to be confused, or they have some kind of disease process going on, like dementia, that's causing them to be confused. But we still have to get that message across to them. All right, we have people who are hearing impaired. You know, we're speaking and we're being clear with our messages, but they can't hear us, so that message is not getting through. And a lot of times people who are hearing impaired, they don't necessarily want to keep saying, what did you say? So they might act like they've heard you and understood you, and they do not. So, again, we need to have the right techniques for dealing with them. Stress and anger, definitely a barrier, right? If you're very stressed out, you're probably not hearing what that person is saying to you. For example, in an argument, you know, you're both yelling at each other, both angry, your message isn't getting across to that person, and that person's message is not getting across to you. And that's why there's so much miscommunication in an argument, because we can't hear, we can't understand what's being said. Culture is a huge one. We're going to take a look at that one more closely. Age is a barrier. I've put a handout on your online class that I want you to take a look at about different age barriers. And aphasia. So we're going to talk about aphasia in a second. So what can we do about these barriers? You know, what can we do about culture, age, stress, anxiety, hearing impaired, confused? We still have to get our message across. So we're going to talk about some techniques to make sure that what we're saying is getting through. All right, so some of them are listed here. Now, obviously, we want to speak clearly, right? We want to face that person. We want to make sure that we have eye contact. Okay, this is especially important when we have somebody who's hearing impaired. Okay, I can't turn my back to that person and have a conversation and expect them to be engaged with me because they can't hear me. So I need to be facing them and close enough so that if they're trying to read my lips, they can do that. And I would add to speak clearly, speak slowly. I have a problem with this myself where I sometimes can speak really quickly and people don't understand me. Especially if you think about somebody who is hearing impaired, or maybe somebody, English is a second language for them. They have to listen to every word that I'm saying and translate it in their mind. So I want to make sure that I'm speaking slowly enough so that they can do that. And that's something that you need to be consciously aware of when you're speaking to your patients or your residents, is make sure you're speaking slowly and clearly. Be patient. Okay, if we have somebody who's very confused, patience is a virtue. We need to be patient. Sometimes you might have to repeat yourself several times, just like if you're talking to your toddler, you need to be patient. Try to refrain from being judgmental. That is something that we all do. We all jump to conclusions the first second that we meet somebody, of who they are. We can't do that when we're talking to our patients or our residents. I can't have somebody come in and then automatically label them they're drug seeking, right? Because if I put that label on them the second that I see them, I'm probably going to let that affect everything that they say to me from that point on, right? Or, oh, they're just a complainer, right? So that we put labels on people. We can't do that. We have to remove all of our labels and try to be open-minded with our patients and our residents when they're speaking to us. Ask questions, clarify. Say things like, it sounds like you're saying this, or is this what I'm hearing? We clarify what you're hearing, because we can't have that miscommunication with our patients and our residents. Active listening. This is really hard to do. If you have a spouse or a close friend, this is hard to do. For example, my husband's in IT, and when he talks about computers, all I want to do is just zone out, because to me, I don't understand it, and it's not very interesting. So sometimes I try to practice this active listening when he's talking about his computers. Try to really listen, really track with what he's saying. It's hard. So I would encourage you to try this yourself. A lot of times when we're having a conversation with somebody, they're speaking and we're not really listening. We're just thinking about the next thing that we're going to say, right? I know I'm guilty of that. I'm formulating a response in my mind rather than spending that time listening to the words that person's telling me. So less is more. That's a good principle to use when you're communicating with your patients or your residents. Let them be the one leading the conversation. Let them be the one talking for the majority of the time. All right? So, clearly, simple words, slowly, face the person, ask questions. If you need an interpreter, make sure you get one. Okay, that should be one of their rights. They should have an interpreter. Don't act like you're rushed. Okay, act like, I'm here for you and this is all I have to do today. You probably have 15,000 other things that you need to be doing. But for the moment that you're talking to your patient or your resident, they need to feel like they can trust you and they can open up to you. And they're not going to do that if you're looking at the door and thinking about all the other things that you need to be doing. All right? So don't be looking at your watch. Don't be looking out the door. Be engaged. Be there. Make sure that you're calling someone by their desired name. Okay? We need to stick away from sweetie, honey, buddy. Okay, these are not your honeys, your buddies, or your sweeties. I know here on the Eastern Shore that's a big thing that we do, but you can't do that with your patients or your residents. A lot of people consider that to be disrespectful, and that's the last thing we want when we're talking to our patients and our residents. Okay, so call them by their desired name. Sometimes you'll walk in at clinical and you'll hear a CNA say, "Hey, Pops, how are you?" But if that's that person's desired name, then that's okay. If they have not given you permission to call them by that name, I would not do it. So if you're not sure what to call somebody, stick with last names. Miss Smith, Mr. Jones, okay? Until you know what their desired name is. Make sure when you're talking to them that you're looking for those nonverbal cues from them. And you can even mention it, I see that you're pacing. Are you feeling anxious? I see that you're crying. Are you upset about something? Notice those things, okay? Paraphrasing is important too. That's probably one of your vocabulary words that you need to know. All right, so paraphrasing, taking what another person is saying, simplifying it, okay? So taking something that's broad and making it very general. So this is what I heard you say. Nodding and smiling, yeah, while they're talking, lets them know that you're listening. Positioning yourself at eye level, that's important. Sometimes we're not good at that, especially if a patient or a resident is laying in bed. Then we're standing over them, looking down at them, and that can make them feel intimidated and uncomfortable. So pull up a chair and sit down next to them, okay, and have a conversation with them. Now, ladies, you need to be careful that you're not bending over in front of a resident or a patient and trying to talk to them, and all your cleavage is hanging out. That's not what I'm talking about. All right, I'm talking about sit down next to them and have a conversation. Right? Try to stay professional. Touch is really good to use. Not in every situation. If you have somebody who prefers not to be touched, I wouldn't put your hands on them. But if somebody's upset, it's okay to take their hand. It's okay to pat their back. Sometimes that really means a lot to people. It means more than the words that we're saying. Okay? Don't baby talk. All right, sometimes you have residents or older people who think that they are 5 years old, but you cannot talk to them like they're 5 years old. That would be inappropriate. Okay, so there's no, we're going to go to the potty now. All right, it's no, Mrs. Jones, I'm here to take you to the bathroom. Okay, so I don't want to hear any baby talking. Using open-ended questions. This is really important, and you'll probably see this over and over again throughout your nursing school career here. Open-ended questions are important. We want the most amount of information. So a closed-ended question could be answered with one word, maybe, or yes or no. So for example, would you like to go for a walk today? Would be a closed-ended question. What would you like to do today? Is an open-ended question. So you're going to get more information. And now, especially if you're asking people about, how they're feeling, are you having pain in your knee? Is not as good of a question as how are you feeling? Okay, because then that person can open up about how they're feeling. Yeah, I'm having pain in my knee. I'm also feeling a little sick to my stomach. If you have an option, go for an open-ended question. Okay, that gives you the most information. Make sure that you guys also review phone etiquette. That's on page 71 in your textbook. That's important for you to know. And then lastly, avoid pat answers. Those are stupid things that we all say to try to make somebody feel better, but we're actually only making ourselves feel better. And you've probably had somebody do this to you multiple times in your life, and you've probably done it yourself. I know I have, and I really try hard not to. So a pat answer, I think of it like a pat on the back, like, sorry about that. Things like, it's going to be okay. Don't worry. Everything will be fine. Everything happens for a reason. God doesn't give you more than you can handle. These are all things that in the moment might sound good to your ears, but they probably don't sound very good to the person that's hearing them, right? Those are pat answers. It's kind of to soothe your own conscience, like, wow, I feel very uncomfortable. I guess I want to make it feel better. I don't really know how. So I'm going to say something stupid. All right, first of all, it might not ever be okay. It might never get better. Things, it might be more than that person can handle. That's another one. God never gives you more than you can handle. Maybe it's more than they can handle right now. So if you don't know what to say, don't say anything at all. I think that was in Bambi, and that's a really good thing to keep in mind, right? If you don't know what to say, then don't say anything at all. Silence.